911, what is your emergency?
Yes, I just got a call from Douglas High School. A female on the line advised they believe there's a shooter at the school.
Okay, at Douglas High School in what city?
Yes, in Parkland.
We live in troubled times. And to have on site a place where kids can go when they've had an issue at home, when they've had an issue with another human being in our building, they're struggling with their own depression, their own low self-esteem, their own lack of self-confidence, hunger. When students walk in the door and they're facing those issues, they're not ready to learn. As an example, being able to, in the same building, connect the licensed clinical social worker from the school-based health center with an administrator that may need to share information with the guidance counselor, with the school social worker and or psychologist. I would argue, anecdotally, that we have staved off a variety of issues because we were able to get together and put our arms around our students and help them before things deteriorated in their lives.
We actually started here in early 2000. We started out, we had a federal grant to do an after-school program, and that was very successful, and the principal at that time asked us whether or not Loyola University Chicago School of Nursing would be willing to start a school-based health center. But over the years, our project has really expanded to meet the needs of the kids, and the kids have needs for nutritional education and interventions, but they also have some very great behavioral health needs.
Providing mental health services in school is exceptionally important. I think when students are given a referral for a mental health agency, there's a lot of reasons why they don't end up going, and so they are just much more comfortable walking down the hallway, setting up an appointment, or walking down the hallway if they're in crisis and saying, I need to see you now, than they would be going to a community-based provider down the street.
In terms of the funding, we've been very fortunate to have funding from the state of Illinois, from the Illinois Department of Public Health for many years. We also have federal funding from HRSA, which is the Health Resources and Services Administration. Our HRSA funding now, which is very congruent with the goals of this task force, is to help us better integrate mental health services into primary care.
We've been one of the lucky schools to not have had a major incident. And while I can't prove it, I'd like to believe that the services, the mental health services provided by the school-based health center are a part of that prevention, that the counseling that they're providing students and the very private issues that they're dealing with students on a regular basis are helping to prevent one of those students from having a major incident or breakdown. You know, we think of school violence as a school shooting. We don't always think of it as a student in the bathroom self-harming. I think I would argue strongly that the mental health services that the school-based health center is providing is no doubt helping to make sure those students have a place to help bear those burdens.
In the 7.5 years that I've been here, I've absolutely seen how our services have interrupted school violence. And so one example I can give is students who come to my alternative to suspension program, after completing the program, if they have a disagreement with a peer or something is about to happen, instead of confronting that peer, they will seek me out for support and say, hey, this is a situation, I really want to talk about it. We're able to talk about it and diffuse it.
It was really a lifesaver, not so much for us as it was for our children and their families. We were not anywhere close to being able to provide the appropriate amount of intervention for our children in the area of social emotional growth, supporting our children and their families in those areas of mental health. We had lots of children that were going without receiving services, many of whom were unable to get to appointments away from school.
For as long as I've been in this field, we have struggled with the financial resources to be able to provide the same amount of mental health support that we would like to, and at the same time we are seeing that our students' needs increasing rapidly.
Regarding costs for school districts, there is no cost to them, so the district just really needs to provide us with private space, access to Wi-Fi so that we can use our documentation, our electronic medical records, and then they provide us with referrals.
I have a lot of thoughts about mitigating school violence, but I mean, I just can't reiterate often enough about early intervention and prevention in schools and mental health issues being recognized by trained staff.
Any type of school tragedy, we can always look back and see some of the defining characteristics of that child's school career. Almost all of them were lonely at some point or another. Almost all of them did have some type of mental health, or at least mental health, significant mental health in the family. Being able to provide that service early on so that we can head that off before they get to that desperate point.
I'll speak very plainly. It's only a debate until someone's dead. See, it's a debate now, and then we all go on the news and we say, well, we didn't think it could happen, or we were doing our best. And all the same people that are debating, we do this very well. We'll all point the fingers and say, why didn't they? Why didn't they? Why didn't they? The combination of a school resource officer engaging in preventative work around potential crimes and so on, not waiting to react like a street cop, but being in classrooms, in the cafeteria, talking with kids, being a resource, and connecting that service in partnership with a school-based health center providing mental health services to those very same students that are talking to the police officer, and he's making those referrals. If we can't see that connection, something's terribly wrong. And having those two running in tandem, for us, it's a no-brainer. I don't know what the debate is.